Okay, welcome to House Human Services this afternoon. We are going to take up sort of some wrap-up testimony from the Office of Professional Regulation. And after that, we are going to be looking at an amendment on S-243, and Ray's got a lot of explaining to do in Lucy terms. So she can update you on all the stuff she's been working on.
Makes it sound like she's in trouble.
No. So Lauren and Jen, welcome.
Thank you so much.
And I have to apologize. Yes, you can bring the chair over for sure. Why don't you take the one at the end of the table there? Yeah. I have to apologize in advance. I have to leave just shortly after 1:30. So if you're still, hopefully, we will kind of wrap things up, but we'll see.
Good afternoon. Thank you so much for having us. For the record, Lauren Hibbert, Deputy Secretary of State.
And I'm Jennifer Cohen. I'm Director of the Office of Professional Regulation. Hello.
Thank you so much for having us. We thought it would be good to just do a brief review of what we have learned that session and what we have heard committees listen to over the course of this legislation's path in the last two sessions. We still feel very strongly that S-206 balances public protection needs with workforce retention measures. That's something that we really studied in our Sunrise, and we've heard testimony throughout the session that both are possible and that regulation of this profession is necessary. Again, we had the Sunrise process, and that really came out of the workforce itself. With the workforce asked us to review whether or not professional licensure was appropriate. And we analyzed that through our Sunrise process, Chapter 57 and Title 26, and did find that there was potential and actual harm occurring as a result of this profession not being regulated. And that we found that early childhood licensure would protect the public, and particularly Vermont's youngest children. We heard throughout the session and in the Sunrise process that early childhood education is not babysitting. That's not something we need to say to this committee. We know you know that, but we have heard that throughout this building, and it's simply not true. Quality early childhood education has big impacts on the long-term success of children. Readiness for school, readiness and capability to graduate from high school, interaction with law enforcement. It has long-term impacts, and having a qualified workforce, a well-prepared workforce, quality education for young Vermonters has impacts and benefits for Vermonters, not just families who are looking for care, not just employers who need their workers to have care, but also long-term system impacts that are measurable and are demonstrable. So this effort has been a result of our Sunrise review. It really came from the profession, but we had multiple stakeholder engagement meetings. We did a lot of data and research, and by we, I really mean Jen Colin. I just want to say big credit to her on all of that work. It was evidence-based and as a result of substantial research and outreach. And as this committee continues to consider this bill and this concept, I do think it's important to read all of the feedback, public feedback that we received that is in the Sunrise Review report as an appendix. It was substantial. There's positive and negative feedback in there. We did not filter. Everything that we received is in there. And it's an important piece of information. We really believe that aligning standards across public and private settings is important, and that it fits in with the universal pre-K model that this committee is so familiar with. We do believe that individual accountability for incidents of harm in childcare is essential for public accountability and for the profession to truly stand on its own, to have its own professional identity, which is something that's very important to the profession, but also clearly really important to protect youth as well. We all have seen media stories or anecdotal stories of harm, but those are really the worst instances. And I think we can do better for Vermont's youngest. So this individual accountability for conduct that may not rise to a media story or criminal prosecution, but is something that could be handled within OPR as an unprofessional conduct case, I think is an important piece. So with that, we've identified the gaps in the current system, and we think that that is primarily easy identification for the public and for facility directors to identify what the qualifications are of the people that are providing care, and easy to find transparent view into the conduct of each individual who's working in a facility. S206 and OPR can fill those gaps. Those are the gaps that we found, and we're confident that this proposal will fill those gaps. And with that, I'm going to turn it over to Jen.
Thank you. So we have forecasted in our Sunrise report and throughout this process, and CDD confirmed that we would work closely with CDD to ensure that the individual licensure system has a streamlining effect, not a duplicative effect. You've heard that individual licensure would reduce significant burdens on facilities to vet the primary educators that are coming into their programs. And the committee also heard from CDD that S206 would ultimately simplify regulation and process for CDD and would provide clearer standards, transparency, and accountability. You also heard from Building Bright Futures on this bill. Anna Brulette testified that the workforce wants this regulation and that S206 would provide a better, less bureaucratic way to manage the qualifications of the workforce than the current system. We also want to underscore that OPR is an umbrella agency created to be the occupational regulator in the state of Vermont. This session, OPR heard concerns, again, that S206 was creating some sort of redundancy, but that's just not the case. We have other models, primarily in healthcare, in which facilities are regulated through other state agencies, like Dale, and then the professionals that are working inside of those facilities are regulated by OPR. This system works well and does not create redundancy. It creates effective public protection. The regulation created in S206 is the only streamlined approach to professional regulation of early childhood educators. OPR is Vermont's only agency solely dedicated to and purpose-built for regulating professional scopes of practice. We are currently responsible for regulating over 100,000 credentials at any given time, and those numbers are growing. We regulate more professionals than every other regulatory agency in Vermont combined. And we do so in accordance with well-established systems and specific statutory criteria that are in Title 26. Put simply, OPR is the regulatory wheel, and generally we add efficiency to professions. And then, just like members of this committee, we absolutely take to heart the concerns about workforce capacity and retention. Since the beginning of this bill and this effort, that's been the primary concern that we have worked really hard to address through different pathways, through variances, and through a decade-long process of transition. So that's what this bill offers. We had conversations with family child care providers. We had conversations with folks like Shannon Folsom from JPEAK and Danielle Harris from the Y. And we're going to continue to engage in those kind of connections with programs and workforce over the transition period and beyond that to ensure that retention remains a priority in this regulatory program. If this bill does not pass this session, we are committed to continuing to engage all stakeholders on this issue. And if and when the legislature does pass this bill, OPR wants this program to meet the needs of Vermont, Vermont's children, Vermont's businesses, and the people working in the profession. So we are very dedicated to that. And happy to take any questions.
Thank you. And I want to say that it's been very evident the thoroughness with which you've approached this work throughout the last couple of years. And that you have been listening to feedback. We're continuing to get more feedback, which is not a bad thing when, you know, something as significant as this is being proposed. So thank you for your comments. Questions from committee members? Thank you both for being here. We really appreciate it.
Thank
Thank you for having us so significantly in this session on this bill. We're not always in this committee. It's been really fun to be here and to talk through these concepts with you. So thank you.
Thank you. We'll continue to have a little bit of conversation on this, committee members, in the next day or so. So you can watch for that on our agenda. Thank you. Okay, we're a little ahead of time. And do we need Katie here to do this? Okay. It's a straw poll. So
And I have, do you have the? You posted it.
okay, so why don't we move to S243, and Ray, the floor is yours, Captain Vice Chair.
Last we left off, this bill.
What did you do?
No, So when this went into appropriation, if you all recall, we had stripped the funding out of this. It was $150,000 for the health department when it came to us from the Senate. And we stripped that money because we understood through testimony that there was money at the Office of Racial Equity that could be used for this purpose. When it went to appropriations, there was concerns about some of the language about shall contract and about the money that's in the Office of Racial Equity, and would this be an allowable use for that money? So they moved forward with an amendment where they reverted $150,000 out of the pot that Office of Racial Equity has to be used for this purpose. On further exploration, and I chatted with Susanna Davis at the Office of Racial Equity and the Health Department, and Susanna and the Health Department sent a memo that is posted, I think it was posted on Friday on our website, that basically confirms that this is an allowable use for those funds that are sitting at the Office of Racial Equity. So the amendment from appropriations is not needed. So what's going to happen tomorrow is appropriations is going to withdraw their amendment because we don't need to call back $150,000. We can just leave all the money at the Office of Racial Equity. And we just had to update our language slightly to basically say that the Office of Racial Equity is going to work with the Vermont Language Justice Project and will contract with them as necessary. And we changed one word. Our previous version had shall contract, and there was some concern about that, the word shall, that this should, because it's meant to be as needed. So as needed, they will contract with them. And so we changed that to may contract with them. And basically the Office of Racial Equity will kind of hold the money. And we're still instructing and directing BGS to help the Vermont Language Justice Project to become an approved vendor with the state. So other state agencies can access them and utilize their services without going through the RFP process. So the amendment is coming from me that basically corrects those little technical changes to say that the Office of Racial Equity may contract with the VLJP to prepare this information and materials at the request of state agencies as needed, and then keeps in the BGS shall, and we slightly changed the language with on that because the previous language we had, there was concern that we are directing BGS to make them an approved contractor, but there's criteria for that. So we want to make sure that they help them through the process. And if they qualify, then they would become approved state contractor
That all clear?
as mud.
So essentially, just to summarize, we didn't need the amendment from House Appropriations. They'll withdraw it. We have an amendment from Rep. Garofano, just changes a couple of words from shall to may and stuff like that. All the same things will happen. Health Department still has access to the resources, as will any other state department who needs that kind of service. And we are still asking BGS to assist the Language Justice Project in becoming a preferred vendor. Everybody okay?
Yeah.
Understanding what we're doing? Yeah.
If I'm recollecting and looking at the last version before it left here, or when it left here, it had called out specifically emergency management. So that's just no longer necessary. They are as eligible as any other state agency
Exactly.
to partner with racial equity. Okay.
Okay. Are people ready for a straw poll? Further questions? Okay, could I see a straw poll? You'll have a question?
We need Rep. City on camera.
Thank
There
you.
we go.
Oh,
Oh, that was.
Rep Steady, that is not a good look.
Yeah.
Nice.
Always sit here.
Hi, Blue.
Get closer to the camera. Your eyes look like they're, oh, it is weird. You'll have to go back and watch it because you look like you, it's weird. Your eyes are, I don't even know how to describe them. So, okay, so can I see by a straw poll, those people supporting the amendment being offered by Rep. Garofano on our bill? Now, there you go. You look more normal now. So Brenda, are you supporting the amendment? Doesn't cost any money. Okay,
Is that a yes?
okay, so that was, yeah, she said yes and raised her
If
hand.
you can see my hand, I can't see my hand. I don't know. There it is.
Yes, okay. All right, so 1, 2, 3, 4, 5, 6, 7, 8.
Great.
Okay, so
I'll be reporting this tomorrow.
great. You along with all the other bills that were postponed. Okay, so tomorrow, I just want to bring your attention to the schedule. We do not have any formal meeting at 9 a.m. So you can do constituent work at 9 a.m. We are meeting at 11 a.m. Hopefully, and we will have language on what is happening with 193. It's supposed to be voted out of House Judiciary. Today. And so I would encourage you, if you're able to take a look at what comes out of their committee, identified as the committee report. I will let you know that I've been meeting with the chair of House Corrections and Institutions, looping in the chair of healthcare. As you know, this committee has been, this bill has been discussed in many committees. So essentially, the way the language, I believe that the language will say is that this will not be in a correctional facility, but could be on the grounds of a correctional facility, but a separate program. Doesn't have to be, but it allows that. It asks for an implementation plan. And essentially what we're trying to do is to mirror the procedures that are already found in Act 248 for the people that we have jurisdiction for in this bill. So it will look very similar to the provisions of Act 248, but now incorporated into this bill. It has the Agency of Human Services, being essentially designated as the place where the medical director will be housed from, not the correctional facility. And I think that was something that we all had strong concerns about. And so I think that this achieves that. The other thing that I want to call to light is that it requires an implementation plan, so they will have to come back. That includes a budget, so the bill itself doesn't contain any money, I don't think. But we will be looking at that. So Lori, if you see it pass out sometime between now and then, feel free to go ahead and load it up on our committee page. I didn't want to do that today because I don't know what the exact changes. I want you to be able to see the exact words that come out of judiciary. So yeah, go ahead.
I'm curious about, I don't quite understand the medical director role. It's a brand new role, right? It didn't exist before. I know they said the job had been posted publicly. We could not find it anywhere. A lot of us who were looking, a lot of confusion about this particular role, also the budgetary considerations, like a new staff person that we hadn't talked about before, a lot of questions about this. Who are they? What is their background? So I don't know, more information, like how do you think we could go about figuring more of that out?
Well, I think that you will like the additional language in the plan that comes back that has to detail a lot of that stuff.
Okay.
So before anything is actually done, it's got to come back to the legislature.
Yeah.
So it just is authorizing step 2,
Okay.
essentially. So, and I just am going to note for Grady and Nolan that we've taken care of 243, so we're all good. Thank you. It was pretty simple and straightforward, right?
Eventually, yeah.
Eventually it was.
Eventually, yeah.
Yes, it was a circuitous route, but we landed on something simple, so
We found some money in the.
Thank you.
thank you.
Oh my God. Right.
So you'll see a much more detailed
Yeah.
version of a plan. And, excuse me, that the thing that we had talked about, which was consideration to opening Act 248
Yeah.
to other populations with cognitive disabilities, to kind of close that gap, if you will. So that's coming back in the plan. I think that there was another item, here somewhere. Yeah, right here. Thank you. So this was a significant change. So in the first part of the bill, we kept hearing from the Agency of Human Services that this bill is about, okay, charged with an offense, punishable life sentence, and the person has to be held without bail and present a danger to the community, right? Okay, well, then there was this little clause in 2B that says, well, if they're not a person held without bail, and they have a qualifying condition, and the qualifying conditions were, it was causing a lot of confusion because they're not really clearly defined. And so that, if you look at the version, I can't even tell what version this is because there's no number on it. But if you looked at section 4815, it's section 2 of the bill. When we saw the draft, it had a paragraph 2B. That 2B is being struck, last I understood.
Okay.
I think that solves a number of the issues that we had in our committee. So I think that between that and the separation of, this being AHS, not DOC led, I think our feedback was heard. But that'll be up to you all to decide when we talk about it tomorrow.
No, there is complete clear distinction with that version of custodial separation and clinical authority.
Mhm.
Your point with the medical director, that's what clarifies that complete distinction between custodial and clinical. The clinical medical director answers to AHS. And that separation is the governance is key.
Yeah. Okay, so we'll see that tomorrow. And then we are, on Thursday, going to be spending, the morning talking about, the various actions that the Senate has taken on 660, 657, and 938. So to be prepared when we actually receive the bills back to know what we're going to do, because time is moving on quickly. And then it slows way down, as we all know. It moves quickly and then it slows way down and then it quickens up again. So, so we want to be ready on Thursday. And then, Dan's bill on tobacco is in next door.
Yep, and they should be voting it out today, so it'll probably be on notice tomorrow and up Thursday, unless it has to go to appropriations, but I don't think it does.
I don't think it did. No, because we took out,
So
we
there's
didn't
any
add
other
the position. We
committees?
didn't add the
I
position.
think that's the end of the line, so.
It's in Ways and Means now.
It's in Ways and Means now, and they're voting it out.
Yeah, it's been to Commerce, it's been to
Yep.
Government Ops and us and Ways and Means and.
As long as it doesn't have to go to, if they decide for some reason or any changes that it needs to go there, it will be Thursday, so that.
Okay. All right. Anybody else have any questions or updates? 6:57.
Passed second reading on the Senate floor just now. So third reading will be tomorrow.
So that's good. That moved up on the agenda. Did anybody happen to know what they did with 660? I'm not sure if that again was one of the things that.
I think it passed. Yeah.
It passed. Oh, was that the one where you told me second reading? Or was that 6:57?
57.
Okay. Okay.
That bill or parts of it were part of the conversation in Vermont this week, last Friday.
660?
Yeah, they were talking more broadly about the decline in opioid overdose deaths. And then there was some reference to the OPC.
Mhm.
And some conversations in this building around the OPC. And specifically referencing Chair Lyons and her response to the new data about the decline in opioid deaths and wanting to ensure then that we are putting money in the right place if we're not seeing as much of that spike in the fentanyl-related overdoses.
It is because of the harm reduction, it's not necessarily because fewer people are using drugs.
Right. Yes, that was referenced.
It's because the harm reduction and which is good. I'm glad that we're out there doing that, trying to save lives. So we will have a robust discussion about H660 because, as we saw in the spreadsheet that Nolan gave us, there's a lot of changes. Okay.
Second reading today, so third reading tomorrow.
Okay, so, as go ahead, Rep. Steady.
I had my not just me, the legislative forum was Saturday, and someone brought up the needles in 660, and I explained it was prevention. Tell me if I did right. I said, you have to think of it as a prevention of people getting AIDS, hepatitis C. So it's more of a prevention than just giving somebody needles. Did I do it right?
Absolutely.
Okay. That's how I
Yep.
explained it.
Yeah,
Okay. Thank you.
you're welcome. Okay, so we'll, as I mentioned earlier, we're gonna have a conference committee on 660. And we'll see how that goes. So other than that, we have a lot of constituent work and waiting to see what happens on the House floor. So you can also tune into the Senate. There's always an interesting activity on the Senate floor. So unless anybody else has anything else,